So thanks for joining us. My name is Anna Hall. I'm the CEO of the Northeast Charter Schools Network, and I am joined here by a great group that I'll introduce momentarily. We're glad to have you here for today's webinar about vaccine mandates and school testing. And that is particularly timely because, as you might be aware, Governor Kathy Hochul, in her first address as governor, less than an hour ago, announced three priorities for her initial term as governor, and the first being COVID safety. And her first priority within that first priority included a statewide mandate for school staff vaccination or testing, as well as universal masking in schools. So let me say that again, and I know people are still coming in from the waiting room, but Kathy Hochul, who was sworn in as governor last night at 12:01 a.m., said that in her first priority as governor, she will include a statewide mandate for school staff to either be vaccinated or to be tested on a regular basis, as well as for all staff and students to be masked in schools. She didn't outline the specific mechanisms by which she would be implementing that requirement, but said that she knew that schools were anxious for more clarity and guidelines, and that guidance will be made available later this week. And so, of course, we'll be sharing it as soon as it's available. We will at least be sending it out by email and over social media. And if it also warrants, we'll hold another webinar so that people can ask questions of great experts like the folks that we have today in order to gain additional clarity. So knowing this landscape is changing literally by the hour, we're so grateful to have legal and medical experts with us today who can provide some context and considerations as this is all playing out. And so do want to add the caveat that while our folks here today have a lot of expertise, none of the information on this webinar constitutes legal advice, and that if you have specific questions that are relevant to your school and in general, we advise that you have dedicated legal counsel for your school and that you consult them, inform them about any and all policies that you're implementing, either in general or as a result of what could be a statewide mandate that we'll have more clarity on later this week. So with all that said, let me introduce our panel for today's conversation. Ellen Egan is a litigator and counselor in California and New York. And I should just say she has been an incredible advocate, as has Paul, which I'll introduce him next, for charter schools in New York, who've been in, well, both of them in some very unique circumstances, I should say, and have benefited from their expertise. So her practice focuses on supporting independent private schools and community charter schools in California and New York that advance progressive education models. She counsels schools on all aspects of governance, including health and safety, discipline, privacy and ethics, employment and equity, and she works with school boards on the formation and operation of charter and private schools. Paul O'Neill is one of the nation's foremost experts on the legal issues impacting education reform. He leads the New York team of the law firm Barton & Gilman, LLP. He's also co-founder and senior fellow of the National Center for Learner Equity. Some of you might know that as the artist formerly known as the National Center for Special Education for Charter Schools, which is a nonprofit that focuses on special education in charter schools. Phenomenal resource as an organization and Paul as an individual. And since the outbreak of COVID-19, he's generated podcasts, webinars, articles, and tools to assist schools in understanding their changing obligations. Has been a great resource to us at the association and to lots of schools. Specifically, I know. And finally, new to us, but very excited to have him, Dr. Richard Pescatore is a recognized worldwide expert in school-based COVID-19 detection and mitigation. He's instituted, operationalized, and overseen testing operations serving millions of people to rapidly identify COVID and halt COVID spread. He's the medical director for grapefruit testing, overseeing testing for tens of thousands of students throughout the nation, and came to us by recommendation of some charter schools that grapefruit testing has worked with in the Northeast region. And I think a new and exciting resource that quite frankly was the sort of thing that didn't exist and we were all hungry for not so many months ago. So we're going to start with the legal perspectives in terms of vaccine mandates and testing policies. So we're going to start with Ellen and Paul. Thank you, as always, appreciate your help and your perspectives, and I'll turn it over to you all to start.
Thank you, Anna. So thank you for that gracious introduction. It was a pleasure to join you all this afternoon to discuss this very relevant topic that's keeping us all on our toes as we start the school year. We wanted to start with a brief overview of the legal landscape so that school leadership has a way to focus in this ever-changing world. I'm going to show 3 very simple slides to illustrate the complexity of the work that we are all doing in creating school policy. This first one shows the nexus of the key law areas that we're dealing with when we're creating school policy. Now, keep in mind, there are many other legal areas, including nonprofit law, business law, but labor law, health and disability law, and education law nexus to create school policy. Are we okay there on the sound, Anna? Okay.
I think so. We had an unmuted folks, so I think we're all set.
Great, thank you. And the next slide, I wanted to point out the overview of the legal landscape in terms of the jurisdictions that are at work here that we need to pay attention to.
So how come mine doesn't have the slides?
So the jurisdictions break down in federal, state, county, and school law. At the start of COVID, many of you might have remembered, the administration established an approach to COVID that put the responsibility at the local level. This put a lot of the responsibility on not only the state level, but the county levels. So it's very important to pay attention to what everyone's saying. And as you all realize, sometimes that results in a cacophony of voices. Sometimes those voices are at odds, and sometimes they talk over each other. And what we need to do is try to straighten those voices out. And we see some of this playing out in other states in the courts. New York has been relatively less litigious than other states, and we're thankful for that. The next slide breaks down these jurisdictions in a little bit more detail. So we are coming out of both federal, state, county, are mandates and guidance in addition to laws and then specific emergency laws. And so it's very important for us to, again, pay attention to all these voices. And as a practice point, it's very important for there to be a point person internally at every school who not only oversees your COVID safety plan, but has these different organizations and agencies bookmarked. And also that you're on their listserv so you can get their updates directly from them. One issue is that the news sometimes does not tell the story that clearly. However, if you go to these agency sites and read the memos directly, I guarantee that you, in addition to thought partnering with your lawyers, can understand some of these laws very, very well. Michael's going to put in the chat some examples of some of the memos that have come out that everybody should see. So obviously, there's the summary guide from NICED that's very helpful. And then the U.S. The Equal Employment Opportunity Commission, the EEOC, put out some very good guidance on vaccine mandates. And then the Department of Labor of New York State put out some very good guidance on the care time necessary to give individuals when they went out to get their vaccine. These are just examples of a few memos that folks should be aware of. And again, getting this information directly from the departments and the agencies is very important, as opposed to listening to the news and probably causing a little bit more confusion. But I just want to add that the true local policy, the true local law is yours. As a school, you have the ability to create policy to advance the mission and vision of your school, and you should take your independence as a charter school and do that work. And so that's why it's important for you to be knowledgeable of the law so that you follow it, but create policy. That policy should show up in amendments to or additions to your employment handbook. And it should be, your boards should review it and also speak to it through resolution in open meetings law. So you are essentially creating local law. And again, that's the beauty of the independence of the charter school. Before I hand this off to Paul, who's going to discuss in detail more about the vaccine mandates, I wanted to address a key question that I'm sure is on most of your minds. And that is, can you ask your staff if they're vaccinated? The simple answer is yes, you can. The misinformation is that possibly you might be thinking HIPAA prevents you from doing that. HIPAA is actually irrelevant to this question. However, the follow-up conversation and what you do with that information, if you know someone's not vaccinated, is a more complex legal issue. And I hope that we have the opportunity to discuss the nuances of that later on this call. For now, due to the importance of time, I'm going to hand it off to Paul because he has a lot of good information to cover regarding the vaccine mandate.
All right, thank you, Ellen. I am Paul O'Neill. Barton Gilman is the law firm, but as Anna said, not legal advice. Just trying to give you folks an update. And as Anna also said, what crazy timing. Yesterday, two important things happened to impact the issue that we're talking about today about accommodations and about requiring vaccination, right? And another thing happened is we have a new governor. And frequently in New York in particular, the governor's office weighs in and has executive orders and other ways that it communicates guidance and really changes everything that we're about to say. So this is good. I would say this is probably good until tomorrow morning. Then you're going to need a new update. So the things that happened yesterday, 2 seconds about that. One, the FDA gave final approval to the Pfizer vaccine, right? So it said, we had previously approved it in an emergency kind of a way, as with the other vaccines, and now we're giving a final approval. Well, the important part of that for you is that you're not supposed to impose consequences on an employee for a limitation that the FDA has put on that's essentially an emergency approval. There's some debate about whether that's okay or not, but it's not an accident, I don't think, that the New York City Department of Education waited until that approval came to say all the teachers have to be vaccinated, all the staff in the schools have to be vaccinated. Because when you have final approval, like came yesterday, it really takes the question off the table. So the two things that happened is the Pfizer vaccine was given that final approval, and New York City said rather boldly that it's not enough to either be vaccinated or take weekly tests to see if you have COVID, which had been the rule previously and is in the rule in a bunch of different states. New Jersey just passed that. But I believe that New York City is now only one of two places, Washington State being the other one, that has said, you know what, you got to be vaccinated. And so that raises this question of, can a charter school require employees and staff to be vaccinated? So the answer is now yes. Yes, you can require that. Do you want to require that? Maybe not. Maybe not. Like I said, it's an extreme position to say that it's not okay to have one or the other. More commonly, you would say to people, we want either constant tests to show that you don't have COVID and are bringing that into the school environment, or you've got evidence of being vaccinated. So you can establish that rule. Is that going to be across the board the last word on this? No, because laws like the Americans with Disabilities Act say that you need to give reasonable accommodations to people who may have a medical condition that would make it difficult for them to become vaccinated. Or I suppose if you're also doing the once a week or periodic testing, if the testing's problematic, they might want to try and opt out of that. And so you have to go through a process where you have people submit their information about why they believe that they have a disability under the ADA that would that would require that kind of reasonable accommodation, you enter into a dialogue with them over this and you make some sort of determination. The other criteria that you could have for seeking to have an accommodation, a reasonable accommodation, would be if it was a religious exemption, and it would have to be a sincerely held religious belief that would prevent you from getting vaccinated, and that's also something that you would have to consider. So schools could and should have a policy that makes it clear what's the rule on this, and could and should have a policy where they consider these requests for accommodations and then act on them. Now, if there's no way to allow somebody the accommodation that they seek, which in this particular case could be, I would like to work remotely. If you can't do the essential elements of your job while remote, it's possible for the school to say, I'm sorry, we can't come to a reasonable accommodation. The standard that's usually used is that it would be an undue burden or an undue hardship for the school to do that. And there's obviously a back and forth with that. I'll give you an example of, I think, the sliding scale that we're talking about. So what are positions that would have a requirement that you be in the building? If you're the custodian, I think it's difficult to say that we could find a reasonable accommodation where you could do your job remotely, right? Let's say you're a teacher. Well, I think a lot of folks believe that being in the building when everybody is back from being remote is essential, and that in order to manage student behavior, in order to interact with the community, and in order to interact with the faculty, that you need to be there. And I think a lot of schools are going to be in a position where they're going to be having these arguments with staff who say, I am simply not comfortable being here. I believe that I have a disabling condition. More remote, maybe we have an ops director, an operations director. Does that person have to be there? Maybe, might depend on what the job requirements are. Let's go to the most extreme one that I could think of was a data manager. Does the data manager really need to be on the ground in the school? My guess is probably not. And so you need to make that analysis as you go through all these things. I'll raise one other issue that I don't know that it fits perfectly neatly into our plan for today, and that's the question of, can you require vaccination of students? You know, we're talking mostly about staff here, but let's talk about that for a second. It's come up recently for me. It's been raised by a few schools that we work with. And I think the best answer to that is, I don't think so. I don't think yet you could do that, because I think that New York state law in a bunch of different ways says it's an open door to go to a charter school. And the New York State Education Department has not said that if you're not vaccinated, that's the rule, you can't go to the school. So that means that a kid who wasn't vaccinated could go to another school. And there's a provision in the New York State Charter Schools Act that says if you're eligible to go to another school, you're eligible to go to a charter school. There's a few other provisions like that. Now, at some point, I've got to believe that COVID's going to go on the list with diphtheria and the measles and everything else that is a mandatory vaccination. You don't get to come if you have no measles shot, right? You have 14 days at the beginning of the school year, supposed to provide that information. Maybe you get an exemption, but at some point, COVID will join the list, I have to imagine. But right now, it would be a bold gesture to say, none of these kids can come here if they aren't vaccinated. All right, that was all I was going to say right now. Anna, you're on mute.
It doesn't matter how many Zooms, how many months. This is the I don't know about how many of you feel like this is your signature move of speaking on mute during Zoom. So Ellen and Paul, before we bring in Dr. Pescatore, I'd love to hear any thoughts about legal alternatives to mandates. And this, is maybe a little bit of a less relevant question if that mandate is about to be coming from Governor Hochul, but I think just in general, talking a little bit about policies to incentivize vaccination among staff and I guess also of students would be great to hear.
Yes. I'm happy to take that, and then I'm sure Paul has something to add to it. I believe that in creating policies that move your mission and vision forward, you can create incentivized policies. And a little bit is about educating your staff and spelling out the policy. So let's play this out a little bit. When you're a vaccinated person and there is a COVID exposure, you do not need to stay home, right? If you are not vaccinated, you need to stay home. And so therefore, care time will come into play. So the question you might have in your mind is, would you have to give free care time as we saw under the extension of ARP on the COVID law that ends at the end of this month? And the answer is right now, you're not required to do that. So if you spell out that point, and again, it needs to be in your policy clearly, and people need to have notice of it, meaning they need to be aware of this. And they realize that if they are COVID, there is a COVID exposure in your school, they need to stay home. They can't use their care time, so it might affect their compensation. That is a way of using the law and educating folks around the law to incentivize folks to get vaccinated and also to stay in school. So that's a way I think that we can create some incentivizing. Paul, I think you wanted to add to that.
Well, Ellen, can I just be very, very blunt about that? If you're not vaccinated and there is an exposure either at school or in your personal life, and you are therefore not able to be physically present at school for 14 days, your pay will be docked.
Well, it's not that your pay will be docked. That it's, you have to, the verbiage is very important. The idea is that you have to use your care time. So nobody has unlimited care time. And as a result, your 10 days, your 12 days will probably quickly be expired. So that's the issue. Now, keep in mind, there's a little bit of a bridge there, Anna. If you're not vaccinated and you also are not vaccinated and you don't have the health or disability or religious exemption, then that would be applicable, that therefore you're going to be out, and then you also have to use your care time. So that's something that you can think about. Now, having said that, you might, because of the culture you create at your school, you might want to extend care time to anyone who is exposed and needed to stay home, right? Some school cultures want to care for their staff. They don't want to penalize. They want to work with our teachers because we understand that rare excellent teachers are hard to find. So you might actually create a policy that reflects more of the COVID ARP law that says that if you're out for any COVID reason, we are not going to dock you care time. You can just use COVID time for that. That's a different kind of policy. And again, those different policies therefore push forward the mission and vision and culture that you want at your school. And that's the sort of control that you have as school leaders.
Helpful. Sorry, Paul, for cutting in front of you.
I'll just add a little bit, and that's just that you mentioned what incentives are okay. I think there's a broad range of them. The EEOC, in a memo that they put out a couple of months ago, that's the Equal Employment Opportunity Commission, talked about this, and it's a sort of reasonableness standard. They're concerned about you doing something that they would consider to be coercive. So it's weird to say, but if you were to say, we're going to give you $50,000 if you get vaccinated, they would probably say that's too much, because that's somehow pushing people in a direction they don't want to go because it's coercive. But if you gave $100, it'd be okay. And I think that we see lots of different ways that states and cities and districts and charter schools have been trying to do this. When I prepare for something like this, I always pull together something that I call a dump document. I cut and paste stuff from online sources, and I include the site, and I just kind of cobble it together. And I'm looking at my dump document on this, and it refers to the EEOC thing. I don't know if anybody would like to have this, but as I'm looking at it, I'm just sort of seeing, if you don't mind something that's messy, I think a lot of the key elements are probably in there from what I just described. And if, Anna, if you want it, I'll send it to you. It'll probably be good until the end of the week, so I wouldn't save it anywhere to your hard drive or anything. But just
we always love links. Everyone's always interested in the links. Yeah, and so I mean, Paul, like, one other quick question that I would pose to you both, and then definitely want to transition to Richard. We're seeing some charter high schools that are incentivizing students So I know of a school that's giving students $100 gift cards for themselves getting vaccinated. So one question is like any perspective on that, and then the other I'd say is one of the things I've seen is even states and cities using things like donuts, right? Like where's this reasonable line between a donut, $100, maybe some extra?
I think, and Ellen may have a different opinion, I think donuts and $100 are on the same side of the line. Those seem relatively modest. They don't seem coercive to me. But if you start to put stakes behind it, and you're giving opportunities to those people that you don't give to other people, and you start to, put some pressure on in that way, I think it crosses the line.
I would add one thing in terms of, again, doing something with the reason behind it. So I think you have to be careful about giving any monetary award to students, unless it's something like a raffle. I think you have to be very careful about that due to some nonprofit law and other issues. However, you could say that any students that weren't vaccinated in high schools couldn't go to prom, junior prom, et cetera. That could be a problem, or participate in some sort of sporting issues that are in gyms and in closed spaces. And then that could be supported by the guidance that we have from the CDC and other entities. So again, I think the policy and putting the why behind the policy supports then you creating these incentivized policies.
Great.
That's super helpful. And I just want to say to everyone, we're seeing all the questions in the chat. I'm going to hand it over to Richard at this point, and he's going to talk a little bit about the options for schools in terms of implementing testing procedures in general. And I know in New York City in particular, but also outside of New York City, this has been just an incredibly complicated question, and certainly waiting to see what the governor is going to roll out in terms of if there is a mandate, if there are accompanying mechanisms to support schools in meeting that mandate. But I know something that we've heard from lots of you over and over and over during the past year and a half is just wanting to have something like a direct partner to work with to be able to implement any sort of protocols that you're looking for. And so that's why we're really thrilled to have Richard here with us. So I'll turn it over to him, and then we are going to hold time for Q&A. So please enter any questions in the chat, and we'll grab them. We'll grab them in just a little bit, and we'll, if we have time, we'll also give people the opportunity to use the raise hand feature if you haven't put your question in the chat. All right, Rick, I'll pass it over to you, and thank you so much for joining us.
No, thanks so much for having me, ladies and gentlemen. My name is Rick Pescatore. I'm the medical director of Grapefruit Testing. We're a COVID testing and consulting company, and very much our goal in our mission is echoed by everything that I'm hearing here today, which is an absolute confusion, frustration, layering of just a bevy of responsibilities surrounding COVID that has been thrust upon you as educators. And when we look at schools, when we look at school districts, when we look at charter schools, what we know is that the educational setting has really transitioned to one of the new front lines in the battle against COVID-19. And the simple fact is that we have left educators woefully underprepared for this when they already have a significant bevy that is called upon them to begin with. So I'd like to just tell you a little bit about how you do COVID testing in schools, what it looks like, and just what that might entail for you. Grapefruit Testing is an organization that was founded by public health professionals like myself. I'm also an emergency physician by training, first responders and researchers from around the country who have eminent experience in COVID testing. When we talk about COVID testing, the first thing to recognize is that there's many flavors of COVID testing. And there are so many people, we've been talking about this for so long, that people are familiar with the sort of dichotomy between there are PCR tests and there are antigen tests. PCR tests go to a lab, they take 2 or 3 days. They can be extremely efficient in finding COVID-19 and very rarely have false positives. However, they have to go to a lab and it can take a day or two. And there's a logistics question as to how am I going to get my results? And it can get, and so there are some downsides there. On the flip side, there are antigen tests. Antigen tests which look directly for a significant whole protein of the virus and do an excellent job of readily identifying individuals who are infected with COVID-19. They turn those results around in about 15 minutes, and we know that more frequent testing with a more sensitive test leads to a better control of the spread of an epidemic through a population. Now, rapid antigen tests, we know, come with significant logistical benefit. You're able to get an answer in 15 minutes, and you can leverage technological solutions to have that result beamed off via text and email, and it's really no problem whatsoever to do that. Certainly, it comes with a trade-off. That rapid antigen test lacks sensitivity compared to PCR tests, and I can go on and on and on. But I think the message that I want to get to you is that this is not your responsibility. It should not be your responsibility. And there are resources that have been pushed out from the Department of Education, the Department of Health, and from the Health and Human Services that are necessarily leveraged by educators to make this a more mountable solution for your school and for your community. And I think that when we take small bites at the apple, and when we take a step back and approach this systematically, we can say this is something that we can do. And whether it's us individually taking it on because we have the extra staff and we have the extra bandwidth, or it's taking advantage of what are a significant number of resources out there to offload this, both cognitively and operationally, to hand this over to the COVID mitigation experts so that our educational experts can do what we absolutely need them to do now more than ever, which is to serve as sort of the captains of the ship of our children's lives. And so let me show you a very brief video. I think it's 2 minutes long, that highlights just how does this get done and what does this look like if we're going to institute testing within schools?
Don't know if it's just me, but can't hear.
Is that nobody can hear? Is that right? Okay, my apologies.
Yeah.
Let's try.
In those stands, what is the likelihood that one individual could be infected and spread it to all others? Whether we're talking about the school setting or really any other congregate setting, rapid identification of patients who are infected with COVID-19, early isolation enables us to stop the spread of the virus, stop that effective reproduction rate, and get people back into their lives. The BD Veritor device uses a digital readout of what's called a lateral flow immunochromatographic assay. Pretty amazing. What it does is enables us to swab a patient's nose, the front of the nose, painless, place it into a small test tube, and then a little bit of fluid is dropped onto a cassette. That cassette, after 15 minutes, is plugged into the digital readout, and it gives us simple positive or negative if the patient's infected with COVID-19.
The tests have been great because they're non-invasive. It doesn't bother my children. Like they know exactly what to do. It's second nature to them. They go out, it's quick. From a parent perspective, it's been a godsend.
With the lowest kids, we're talking about a little Rubbermaid cart, a testing machine, and some hand sanitizer, and that's the whole test kit. Here at the high school, they're all coming through the gyms where we have our testing system set up. We just process them through.
We have a growing testing footprint every single day. We're up to somewhere between 30 and 40 schools that are performing antigen testing.
There's nothing about this program that can't be done in any school.
This is the BD Veritor device. It's about as simple as it gets, the size of maybe a deck of cards, a little bit bigger, can be charged, and it's mobile. And that's pretty incredible.
You don't need trained medical people to run the test.
As a multimodal training approach, there's some fantastic online training resources available from BD, and that's a real critical element. And schools such as Mock Charter have been amazing in training other schools in how to implement these processes within their own districts.
We're willing to do whatever it takes to get your child in school. This is something we can do to both make it safer and to make it feel safer.
Antigen testing enables us to very quickly identify students, teachers, faculty, or staff who are infected with COVID-19, immediately remove them from the learning environment, and it helps us keep schools open, helps us keep students safe. And that's about it. It's not really overly complicated. It's not some big giant lab machine that gives you a result within 15 minutes, tells us whether patients are infected with COVID-19.
And so the message that we wish to get across is one that COVID testing within schools is a very consumable and achievable task. There are innumerable resources from the federal government, from state governments that detail how this can be done with school resources, and that's an important component. However, it is worth noting that in the interim, there are a number of private companies, Grapefruit included, that have filled the space to provide no-cost testing solutions fueled through the privileges and the experience and the support leveraged through federal grant opportunities to bring sort of experienced and automated and comprehensive services to your school, to cognitively and operationally offload your COVID operations to bring solutions to your community. Now, I want to close with questions that our legal experts had such an important discussion that about the intricacies of the regulatory experience surrounding COVID-19. And I want to highlight the importance of adherence to those regulations in consultation of legal and medical professionals whenever appropriate. We are fortunate to have a testing footprint that spans from ocean to ocean and have experienced, unfortunately, those scenarios when school partners did not interpret these regulations correctly. And because of that, we do always highlight the importance of legal and medical counsel to engage in this. Certainly in our Grapefruit model, we do dedicate a regulatory specialist to each school to make sure that every compliance block is checked. But when we enter these sort of more dangerous waters, if you will, when we begin to step out of our lane and to engage in the process of contact tracing and case investigation and COVID testing, I want to get two underlying messages to you. The first, that this is an achievable task and one that is important and has been well demonstrated to keep our kids safe in school. High frequency, low barrier testing has been excellently demonstrated in both modeling studies as well as real world evidence to show that it can keep COVID out of schools and keep children safe. And the second thing I would offer to you is to remember the bevy of resources that are available to you from both the public and the private sector to ensure that educators can focus on doing what they do best and what they do so critically importantly, which is supporting our children in their learning and growth while making sure that they're kept safe through those resources provided. And that's all I have. Thank you all very much. And I can be reached. Let me share that slide one more time. My email is richard@grapefruittesting.net. My email is richard@grapefruithealth.net, not grapefruittesting.net. My apologies. Perhaps more importantly, my phone number is listed at the bottom of the slide here, and we're happy to discuss this further and point you in the direction of any resources which might be helpful. Thank you.
Thanks so much. And there are some questions coming your way from the chat. So I've collected all the questions and I've tried to do a little bit of thematic grouping of the ones that have been in the chat so far. So the first couple are going to be for Paul and Ellen, but then Rick, there are a couple about sort of best practice testing coming your way. So Paul and Ellen, there's a whole series of questions related to this idea of care time, COVID time, sick leave. And so I'm going to sort of read them all together, if you will, and then would love you guys to weigh in. So Ellen, I think, this idea of care time, which many of us may inhumanly acronym as PTO. So this one question is, what is care time versus COVID time? And then another couple of questions are around what is the New York State requirement for COVID paid sick family leave? And isn't there a requirement for organizations of more than 100 employees to offer up to 14 additional paid sick leave days in addition to regular days related to COVID? And then just to cap it all off, and always love Jay Nanda for asking the sock it to you question, which is, as a school, can we tell employees they can't use their paid time off, PTO, for COVID quarantine if they're unvaccinated? So lots there. Thoughts?
Yeah, let me take the second one because it's an interesting one. And I think it really kind of flexes the muscle of this independence as a charter school. You have the ability to determine the reasons for care time. I think it's And so that's an interesting, I don't think that the short answer is no, you can't do that with regard to saying how you use the care time. The problem is that it has to be kind of thought through in terms of whether someone is actually sick, right? So the issue that's making this a little bit complex is the law that went into place for New York paid sick leave went into place pre-vaccine. So anyone who was exposed had to be quarantined. Now, if you're vaccinated and you're exposed, not if you're showing symptoms, but if you're exposed, you actually do not quarantine. So this law pre-existed this issue of not having to go out on quarantine. The New York state law that requires the 14 days of paid sick leave, not because you're a business over 100, but because you're considered a public employer. Okay, so that means it applies to all charter schools, not just the size of the school. Is supposed to be sunsetting, similar to the federal law that is sunsetting at the end of the month. So I think that we're going to see some guidance later this week, I'm hoping, from the governor that references an amendment to this law that talks about allowing the 14 days, because the whole purpose of what the governor is doing and what the state's doing and the county levels they're doing is incentivizing people to get the vaccination. So it doesn't make any sense to allow 14 days for folks to be able to stay home by not taking the vaccination. So there's going to be a nuance or an amendment to this, and we have to pay attention to that. So keep in mind the other pieces is that if you're unvaccinated and there's exposure, and there's going to be a lot more exposures because of the way this particular Delta variant is working, I feel that you can be out more than 14 days very quickly by December. So again, even if you're required to give those 14 days of paid sick leave, you're going to maximize all of the care time that your entity gives you. And so I think that, we have to kind of keep we have to keep an eye out. Again, you got to keep on these listservs for the Department of Labor and the Department of Health of New York State and see what the guidance is on the specific issue relating to the 14 days paid sick leave. But it quite frankly, logically, it has to change if there's going to be a vaccine mandate.
Absolutely. Paul, any thoughts on that?
I agree.
Great thoughts. Great thoughts.
And you muted yourself.
I told you it's my signature move. I mean, there are 195 people here who probably see me do that 195 times. So I thank everyone for your generosity of spirit. But lots of questions coming through about this potential Governor Hochul mandate. And so I'll read through a couple of questions so folks know that we're hitting your questions. I'll give my thoughts, but then Paul and Ellen would love to hear yours. So one question Sarita asks is, will charter schools be required to follow the governor's guidelines on vaccination requirements? Another question asked by someone on an iPhone is, when it comes to vaccinations and testing, do charter schools in New York City follow the mayor or the governor? Then for non-New York City schools, am I correct in understanding that the governor's mandates will require all school staff to be vaccinated or have ongoing testing? So let me say what I think we know right now, based on the relatively short initial statement that the governor made, again, less than 2 hours ago, and what we know from the prior governance actions around COVID in schools. And then again, Paul and Ellen would love to have your words of wisdom on this. So if the governor makes an executive order or institutes some sort of state of emergency, which was most of what allowed Governor Cuomo to operate and create the literally hundreds of executive acts over the course of COVID, things like delivery alcohol, for example, the waiver of the public meeting law as another example, all things that many of us grew to know and love. those were the result of a state of emergency and executive order. If Governor Hochul takes that approach, then that sort of trumps everything, if you will. All entities are ultimately subsumed by that act, by that statement. If the governor works through less direct channels, so for example, SED, which is ultimately in control of many districts, but not necessarily the New York City DOE, then it's a little bit less clear. The fact that the New York City DOE has already communicated, that Mayor de Blasio communicated, as Paul mentioned earlier, a plan for a vaccination or testing requirement might make that somewhat easier for her to do without the sort of extreme mandate of an executive order or state of emergency. But if I were a charter school leader today, I would begin to operate under an assumption that I can or should be anticipating a vaccine or testing mandate. The major question becoming, what resources might the state make available to me for that testing piece? Or should I be talking to someone like Rick to make sure that I have some sort of in-house direct resources and I'm not asking some subset of teachers to be going to, CVS or Walgreens on some basis and hearing from them how that's like not conducive to their lifestyle. So I'll pause there. Paul, Ellen, anything that you would add, edit, subtract?
I would only maybe add to the point about COVID testing. I mean, it'll be interesting if actually the executive order says that schools would be required to offer testing. I actually don't think so. I think that would be kind of part of the incentivizing teachers that they don't need to go for weekly testing. And it might even be in our own local school jurisdiction determine when that testing happens, like on a weekly basis. To me, that's going to be a very burdensome act for staff. And so it would incentivize vaccines. And we do want to incentivize vaccines because, again, if you're exposed and you're not vaccinated, then your teacher is out for 2 weeks. And that's a burden on the school. Right. So I think that I'm very hopeful, and I would be, sort of shocked if we had to give COVID testing to staff, and testing to children is another story because there's no vaccine right now for that under 12 group. So I just wanted to kind of add that point as a way to, I guess, curate a culture through the policies and how you're educating your staff. Paul?
Yeah, I guess I would just say the previous governor wasn't shy about weighing in on COVID issues and utilizing the sort of emergency element of things. And it's hard for me to guess exactly what the content would be, but I would say that if the governor issues an emergency executive order that addresses these issues, it will say on its face whether it's applicable to charter schools or if it makes a distinction about charter schools. And I think odds are that would be applicable to charter schools. Another important consideration is that charter schools are required under the Charter Schools Act to follow the same health and safety rules as other public schools, right? So if the Department of Health, if the New York State Department of Health says something, hey, everybody needs to do something, well, then that also comes with its own authority. I noticed in the chat, someone asked, are we responsible as New York City charter schools who are located in district buildings for following the New York City rules about this? And I would say that's a good question. And those kinds of friction elements have come up throughout COVID. There was some question for a while about whether charter schools should benefit from some of the contact tracing that the city was paying for the district schools, not the charter schools. Been a lot of back and forth about that. And I would say that it seems to me that as a distinct LEA, that the New York City Department of Education and its determination about who has to be vaccinated isn't binding on charter schools. But someone might make an argument that co-located schools impact the healthiness of the kids in the other programs, you might expect there to be some friction on that, but I know you have to follow the state stuff. Anna, you're
I'm gonna do a hat trick in this one. I think that's really right. I also think, above and beyond what the legal mandatory requirements are, people should really be thinking about the optics. And that if you are side by side with a school in district space, not even for the sake of your relationship with the district, or if you're not in New York City, but you are in a district that has certain requirements and your requirements are less stringent, from just a community health and safety perspective, the message that you're sending about your participation as a part of the solution and not part of the problem, if you will.
Yeah, if I could just add to that a minute. I just wanted to add something to that, Anna. I think that some of the county commissioners are meeting regularly with their superintendents and their local private schools. And I noticed that some of them forget that charters exist. And this is a silver lining moment for charter schools to say, hey, we want to sit at the table when you have these meetings. We want to be on your listservs to your county commissioners, your county health commissioners, so that they recognize us as part of the public school sector. And I think this is a great opportunity for them to also hear the innovative ways that we're dealing with this, so that we can kind of present these kind of protocols that we're establishing locally in our charter schools and kind of brag about them a little bit to the greater school sector. So I agree that optics is important, and using our opportunity to make folks know who we are. And I notice some of the county health commissioners don't even realize that they have charters in their counties.
Yeah, totally agree. And I will say we've had a lot of success in Buffalo and Rochester in particular. And also I give a lot of credit to Corey Callahan and the folks at the Charter Center in New York City, just in forging those direct communications with county departments of health, because that's the other thing for people to be aware is that, at the end of the day, until and unless there is a governor's mandate, the county department of health, even in New York City, trumps the superintendent. So the county department of health, the New York City Department of Health, trumps Mayor de Blasio, should they decide to make a mandate, or should they be the agent of the governor's mandate. And so having those relationships and paying attention to what those communications are is really critical, and certainly being at the table. And I think, my experience has been that those folks have been really impressed with and gratified by the engagement and attentiveness and consideration of charters. So totally agree. So Rick, just from an operational perspective, could you speak a little bit to if a school wanted to implement a testing protocol, so the specific question is, what's the recommended testing protocol in schools? How many staff or students per week? Is it okay to test one full class or cohort, or should it be a random group across the school every week? And certainly this assumes that there won't be some sort of mandate or clarity associated with the governor's guidelines. But just in general, if a school leader who's listening in right now says, yes, we absolutely want to pursue some sort of a testing protocol. We want to make it either mandatory or available to families. Talk a little bit about what the best practices would be in terms of standing that up.
Yeah, that's a great question. And the first thing to do is to decide your needs. This varies across the country. The most common model is once weekly testing made available for all on campus. There are some states throughout the country, California comes to mind, that have instituted a modified quarantine protocol where students who are exposed can remain in school if they test negative twice weekly and remain asymptomatic. And so there's a variety of this across the country, with the most common model being once weekly testing of all unvaccinated individuals continuing to be the recommended approach. And that's certainly recommended and always hinted to in these discussions of vaccine versus test and as we go forward. Now, if you decide to implement testing, It's important to recognize that the perfect model is that there is no perfect model, but more people testing more frequently leads to a better possibility of lassoing and containing the virus. Screening testing, which is different, of course, than surveillance testing, which is de-identified testing, and different than diagnostic testing, which is the kind of testing you might expect or approach in a doctor's office. Screening testing is used to rapidly detect, diagnose, and isolate infectious diseases circulating within the community. And so more participation more frequently is always going to lead to the best outcome. If you want to implement this, it begins with an assessment of your capacity, and it begins with an assessment of your ability to do that testing within your own resources. Most commonly, we found that the personnel dedication arrives at something of two FTEs per 1,000 individuals being tested per week. And so that's a fairly good jumping off point to begin to parse out how you're going to approach testing within your school or district. And from there, it's just simple math and simple calculations of finding what kind of testing am I going to do? There are a number of regulations that go around this type of testing, including securing a CLIA waiver, an LLS, or a limited laboratory certificate from the New York Department of Health. So there's a lot of things behind this that go behind it, but they are all listed and can be found and certainly can be approached. And I would highly recommend to do it in concert with somebody who's very familiar with these processes and regulations, but it's certainly an achievable hurdle. And I'll leave it at that.
Awesome, super appreciate it. So I know that we're running out of time. I recognize that there are some of you who we may have gotten to your question generally, but not specifically. And so Mike, if you don't mind just dropping your email in the chat, I want to offer as a resource, send your emails, send your questions to us if you feel like they weren't covered, and we will work to get answers to them and see about a way that we can also make sure that everyone hears back those answers. But I think the other category of question that I'd love all three, Rick, Paul, and Ellen to speak to is around sports mandates, and Ellen sort of touched on this earlier when she talked about like potentially requiring vaccine in order to participate in prom. But if you all could sort of touch on this idea of mandating either vaccines and/or testing for sports or student extracurriculars.
I'll jump in first from the medical perspective. We've had the experience of getting testing in nearly every country across the state right now, and one thing across the country right now, and one thing that is consistent is that mandates for participation in testing, mandates of participation in testing for participation in sports are quite common, and so I would imagine that the legalities of it, and of course I'll defer to the experts here, are very clean.
And I'll just throw in that I noted in the articles yesterday about New York City requiring that all teachers and staff members be vaccinated. And I'm just reading here from AP. Mayor Bill de Blasio announced Friday that coaches and students in football, basketball, and other high-risk sports would have to get inoculated before play begins. So it's clear that the city is taking, again, a strongly assertive position about that. I think, getting to what Rick was saying, I think there is justification for saying this is a health-related restriction. And so I would imagine a lot of people are going to do it.
Yeah, if I could just add that Section 3 has, again, in the jurisdictions, actually Section 3 has kind of grabbed its power as well. So that is, one of the, leagues that our students are a part of. Depending on your school, you need to know your section, and your AD or someone in the school is in communication with your section. And they have actually put out individual mandates regarding certain things such as contact sports. And then working with the relevant counties again to say that anyone playing a contact sport needs to either be vaccinated or get the testing, depending on their age group. So again, that's where they've almost working as separate and apart from the state. In absence of the state saying anything, the section has made these mandates. Now, the question is whether you're required to follow it. if you agree to be part of the league does define their position is the league does define kind of the rules and procedures and protocols of the sport, and so they feel like they had the last word on that. So in absence of the state saying anything, the governor saying anything, you have to be attentive to your league's protocol regarding COVID. And again, we haven't seen a ton of litigation around that in New York State. There might be in other leagues in other states we're seeing it, but you know, we haven't seen any pushback.
That's super helpful. Yeah, and so thank you, Ellen, Paul, as always, and Rick, thank you so much for joining us. And I think all of the panelists have already put their contact information in the chat, but I'll ask them to do it one more time. And I will say on behalf of Ellen and Paul, they are lawyers, they are not your lawyers until and unless you choose to make them so. And I know Rick is happy to be a resource to folks to consult and advise and to provide resources around testing and potential vaccination clinics. And my personal advice to folks at this point is, I think we know what the landscape is, and I would, if I were you running a school right now, I would make every effort to make as much testing and vaccination both available and required in the context of your legal counsel's advice and your staff and student handbook as you're possibly able to be, because I think that's the direction that we're all going. And the sooner that you can sort of get ahead of that and get your school community on board with that and have the operational capacity, you know, with a group like Grapefruit or otherwise to implement those things, the better off that your school community is going to be. And I think, like I said, that's the train that I see coming down the tracks. And when we have more information about Governor Hochul's mandate, we'll be sure to share that out and potentially have a round 2 of this. We might be asking some of our friends for an encore performance, depending on what we hear from the new governor. So thank you again to everyone. Be well, stay safe, and we'll see you soon.